decades of excellence, a lot of innovation and transformation. I'm joined by Dr. Doaa Marouf, the CEO of AKI Pharma and BinSina Pharmacy today. Very warm welcome, Dr. Doaa. Thank you so much for joining me on Retail ME TV. And I'll start with congratulations, of course.
Thank you.
6 decades in the region, a lot of transformation, I'm sure, a lot of milestones. And I'd like to take that as my starting point. If you could run me through some of your most significant milestones over these 60 years.
Thank you. Thank you very much for inviting me today. I'm really glad to be with you and
Pleasure.
to try to give you an overview about BinSina Pharmacy milestones over the last 6 years. Actually, as you know, BinSina started 1965
Yes.
in Dubai, which is 6 decades ago, where Dr. Saad F.Al Khayyat, our visionary leader and chairman, who decided to be part of the healthcare industry and the community by providing the best services to the communities and families and generations over many years. We started this legacy in Nasser Square, in old...
The iconic Nasser Square.
era. Yeah, and today growing to 150 pharmacy. This legacy actually continue through his son as well, our managing director, Saad F.Al Khayyat, and his vision to be part of this industry, adding value, contributing to the healthcare system by touching the lives of every families in UAE.
Sure.
And being part of Al Khayyat group, actually we are always looking to have a meaningful impact on the lives of the community and our consumers in general, not only patients, because in BinSina we believe that it's beyond the dispensing prescription or giving the medication.
Yeah.
It's about the lifestyle, healthcare, personal care, and beauty care. A lot of milestones, we can talk about it, and I can say BinSina is paving the way for retail pharmacy business in maybe not in UAE only, maybe in the region where we started the first pharmacy chain in UAE. We started introducing the concept of being in the mall, not only in the high street or linked to the clinic or to the hospital, closer to the community that we are serving, closer to our consumer patients, trying to provide services every day, a meaningful health education and consultation and advices to the community. We also can talk about how we introduce the innovation, the services to the community. Where in today where we talk about the AI and e-commerce, not only the brick and mortars but also the e-commerce. We try to be close to our community, and we had the first MOH-approved e-commerce platform by Ministry of Health and Prevention. And we're really proud about these milestones in addition to other milestones and initiatives that we did.
Absolutely, absolutely. And over the years, I'm sure you found many ways of plugging gaps, if I may. Because there are healthcare providers and then there are pharma retailers like yourselves. How have you plugged the gap that existed, that in-between space?
Yes. Yeah, we consider ourselves as an integral part of the healthcare system, where we complete and complement the role of the physician and the hospitals by giving the right education to our patients and to consumers as well, and also to fulfill the unfilled needs in the market, where it comes to the more into beauty inside, outside, let's say, the personal care. that we're providing. We did that through our brick and mortars by growing the engagement with our community and
Could you give me some examples specifically within the brick and mortar space?
Yeah.
It could be through consultations, it
Yeah.
could be through technology.
Yeah, for example, from the consultation point of view, the pharmacy is not only the place where you get your medication.
Sure.
It is the trusted neighborhood personnel who has a healthcare
Yes.
knowledge. And also, he's a knowledgeable friend that you will come back to him always when you need a quick solution. So the simple things.
Oh my God, 1 a.m. toothache.
Yeah.
What do I take?
Yes, exactly. It is simple for the pharmacist, but it might be look complicated for the individuals, because at the end of the day, it's based on the knowledge, science. You need to take care of many things when you speak to the patients, his age, gender, life, history, medical history.
Absolutely.
If there is anything ongoing, seasonal, for example, in COVID time, how you will help the community to overcome the panic, the psychological situations.
And just simply making everything available at the doorstep.
Yes.
I think to a large extent we are spoiled. We want everything, we want instant gratification, that's one. And then we want everything delivered to the doorstep within minutes. And BinSina and other pharma retail companies are actually fulfilling those needs.
Yes.
So, I mean, some words on that would also be very interesting.
Yes, of course. So, as you know, today, even the new generation, they would like to have everything delivered to their home, where we, in addition to the evolvement of the brick and mortars, we also adapt the AI technology, the e-commerce, the automation, where we make it even easier and accessible for our patients, not only to receive the products, but the services, the education, awareness, trying to be part of the protection more than a treatment, because we're trying to help them to stay healthy more than to get sick and then treated, which is our mission is to make sure that they come to the pharmacy for an advancement more than for a treatment.
Preventive.
Yeah, we are playing that role.
Yeah.
And we also, for the gap, for example, we have a lot of initiatives we did with the Ministry of Health and Protection.
Okay.
Like we do diabetic screening in the country alongside with the Ministry of Health and other partners. We're doing vaccination ongoing for the flu vaccine.
Okay.
We established the Diabetic Excellence Centre, where we give advices for the diabetic patient, which is a very high number of diabetic patients.
In the region, yes.
So this integration with the government and even private stakeholders really position us in a way or another to fill the gap and to fill the fulfilled needs.
That is fantastic.
So.
You were also talking about technology. And when we talk about technology, we also think about data. Data has become so important across industries. And healthcare is one industry where the margin of error literally has to be nil. And you have to protect data privacy while you use that data to benefit the business at the end of the day. How do you balance these two things? How do you balance data security and using that data to personalize your services?
Yes, we deal with the data seriously. It is something you cannot really compromise with.
Yeah.
Where the data is very important because it's beyond the names and the address of the patients, but also there is a healthcare data with which we are treated with very careful guidelines that we have from the Health Insurance Portability and Accountability Act, and we are working strictly with the law of the United Arab Emirates data protection policy. And we also formalize our internal policy to make sure that the data is protected all the time,
Okay.
And actually, this is not only important to secure the data of the patient, but it's also reinforce the confidence and the trust that the community has in BinSina, where we're using this data only to make sure that this data is useful for the patients themselves, and it will help them in the time they're missing anything that we can provide it. So this is very serious things, and we're proud that we register a zero breaches of data protection over 2023 and beyond, as per the ESG committee that we have within the group.
Okay, that is fantastic to know. Dr. Doaa, if I may turn my focus to BinSina now, purely, your growth strategy. Where do you see BinSina? What's the pipeline like for 2025? How many more pharmacies are we going to see? Are we going to see any new formats coming up, smaller formats, express formats, anything new? Anything on the digital side of things? Are you looking to go beyond the beyond the country?
Yes, we have a lot of plans. I want also to take the opportunity to thank our team and the generation who worked for BinSina for a very long time, for 6 decades. Today, what we see in BinSina and how it's positioned in the market, and how the client and the community and the customer see BinSina, the credit goes for this army who worked for BinSina since 1965. And definitely the growth we had, it was based on the vision that introduced by the chairman and the MD and the board directors in the group, that we want to be part of the life and the community healthcare, And of course, we are, in addition to the brick and mortars, in UAE, we started our journey in Oman, and we will open another 6 pharmacies in Oman by January 2025.
How many do you have, right?
We have 1. We started it last year, and we're opening 6 together by 2025. Our plan to have more than 30 pharmacies in the next 2 years in Oman. Also, we're thinking to expand in the GCC.
And very quickly, how many, what's the network of BinSina Pharmacy right now in the UAE? How many pharmacies do you?
Within UAE, we have almost 150 pharmacies. Okay, and we have our platform, so we have an omni-channel where we can also be engaged with our customers through the call center, where we have more than 20 call center officers. They are all pharmacists. They're helping the consumers when they call, and they are helping in dispensing the prescriptions and the delivery. We have our website, Arabic and English, and our application as well. We're working with the aggregators, and also we have other dimension where we also investing massively in the AI, in the IT, in supply chain. So we just completed our new fulfillment in Jabal Ali in Dubai Industrial City with 1 million square foot with fully automated warehouse to serve the growth of BinSina for the next decades to come.
That is wonderful. And my last question to you, Dr. Doaa, when you think about pharmacy of the future, what comes to your mind? How would you summarize?
See, having begun my career as a pharmacist, as a trainee pharmacist in BinSina in 2002, I'm convinced that the brick and mortar will remain the main contact and the main focal point between the community and the pharmacist, because this is human touch, and the comfort and the trust that you build, and the confidence that the patient want to feel. That you talk about health care and about the treatment, medicine. So it is not like any other retailers, where people, they want to feel comfortable, having the right educated message. They want actually to see the reaction, and they want to see the confidence of the service provider and to which limit he's really giving the right one, and to build that kind of bind between them. But also we need to highlight that digitalization and artificial intelligence and automation that will help the community, will help the pharmacy community to actually advance their services and advance their support to the community through freeing up from the repetitive actions, smoothing the supply chain, availability of the products, having a new technology, and trying to help patients to use this technology in the best way ever.
Thank you so much for joining me on Retail ME TV. It was a pleasure chatting with you, Dr. Doaa.
My pleasure. Thank you very much, and I appreciate it. Thank you.